Hi, my name is Sive. I'm one of the physiotherapists here in the Rotunda Hospital. Today we're going to be talking about different movement strategies to help manage your pain. It can be quite common to experience some pain at the front of the pelvis, in the pubic bone, or possibly into the inner thighs and into the groin area. So if this is something that you're experiencing, it can be quite helpful to do some massage into the inner thighs because you might notice there's a little bit of tightness in these muscles. So it can be really useful to use a spiky ball. You can also use a tennis ball as well if that's what you have at home. So what I'd say is start kind of close to the knee, work around in circles, and then come up the thigh. And then if you feel like there is a point of tenderness or tension, just kind of focus on that area, even a couple of minutes, just working into it and breathing through it. You can also hold the ball onto the thigh to try and release that point of tension also. It may also be beneficial and helpful to put both fists between the knees and squeeze the knees together if you're having some pain at the front of the pelvis. Holding this for 5 or 10 seconds and then fully releasing, and then trying to do that again. Maybe doing this 5 or 10 times, and then hopefully it will start to ease. You might find applying some ice onto the pubic bone if you're having some pain and tenderness over the pubic bone also. Make sure that you wrap it up in a towel and you're not placing it directly onto the skin. It can be useful to use it for around 10 to 15 minutes. If you're experiencing pain into the lower back or into the glutes, it can be really useful to do some massage into that area to release any tension that might be in the muscle. So place your spiky ball or tennis ball into the glutes. Try and place it into the bulk of the muscle, and then what you're going to do is come up and down, around in circles, side to side, whatever feels good for you. Then if you're having any lower back pain, what I'd recommend is placing that onto the lower back, again into the bulk of the muscle, coming up and down, coming figure of eights or side to side. Doing that for around 5 or 10 minutes can be really useful. Sometimes even doing it before bed can feel good. If you're experiencing any pain in the hips, the glutes, the lower back, heat can also be really useful. So something like a hot water bottle. We don't recommend that you're using any heat directly onto bump, but onto the lower back, the hips, the glutes, absolutely fine.